live soon. Good morning and welcome. I'd like to introduce Jenny Barrow, occupational therapist and ATP, presenting on equipment needs. Following Jenny's presentation, please join us from a short message from our sponsor, TrueLeave, and then a break from 9:37 to 9:55. Thank you, Jenny.
Thank you, Melissa. Good morning. Like Melissa said, I'm Jenny. I'm an occupational therapist. I'm here in Jacksonville, Florida. A little bit about my background. I have been doing wheelchair clinic for about 16 years here in Jacksonville at UF Health, and then I also was part of the UF Health ALS comprehensive team, and so I was the occupational therapist on that team. And so I've been working a lot with the ALS population. And a lot of what I do is help patients navigate through equipment needs. So my presentation today is going to be just on equipment needs and things that everybody needs to think about. So let's get going. So one of the biggest things is, what does insurance cover? So some of the things that I've listed here are toileting needs. The only thing that they cover is a 3-in-1 commode. So insurance will cover that with a prescription from your physician. Bathing needs, absolutely nothing. Some of the transfer needs that they will cover is a manual Hoyer lift, semi-electric hospital bed, and lift chairs. And I put in parentheses, sort of. So transfer needs, the Hoyer lift is manual, meaning that it's a manual crank to raise and lower you, and then you have to obviously manually push the Hoyer lift around. Semi-electric bed just means that they will cover the raise of the head and the raise of the feet, but it's a manual crank to increase and decrease the height of your bed from the floor. So mobility needs, cane, walkers, now just one type, one or the other, manual wheelchairs, scooter, and then a power chair. Transport needs, there's no coverage for car carriers or adapted vehicles. And then home modifications, no coverage of ramps or remodeling. And then down below, I put, it's really important to note that if you have VA, none of the above apply. So anytime you would come into clinic, one of the first things I would ask is, do you have VA benefits? And if you do, you kind of go through the VA program, and you get assessed by a therapist and the physicians, and they actually do have quite a bit of funds that cover a lot of anything that you need, car carriers, home modifications. And so you want to definitely check out VA benefits if you have an ALS diagnosis. All right, so back to the purpose of the equipment is obviously to promote independence and safety for those of you with ALS. But as therapists, we're also very concerned about the caregiver. So the 3-in-1 commode is often used over an existing commode because it already gives you, quickly it'll give you arms, they'll give you the height adjustment of the commode over your existing commode, or you can use it at the bedside if you can no longer make it to the bathroom or your bathroom just isn't accessible. And then with bathing, you got to look at obviously your bathroom. Which one do you want to use? What are your goals? Do you have a spry caregiver? And then obviously how deep are your pockets? Some suggestions that we start off with are shower chairs, transfer benches, extended hoses, and grab bars. Those are the least expensive. Those are usually the ones that'll make like a tub shower accessible for somebody. The biggest thing that we are trying to promote, obviously, is safety. So a transfer style tub bench is one that has 2 legs that go inside the tub, 2 legs that go outside the tub. So you're sitting first. You're not having to stand and lift your legs up and over a shower. And I tell everybody in clinic, that's the one place we don't want to fall, because we're naked and we don't want 911 to come and get us in that situation. So most of us, no matter if we have ALS or not, that's most of the time where we're falling. And then obviously you can do full remodel with roll-in shower chairs. Obviously that's the primo. Again, I put on here, therapists are a good resource to discuss options based on, kind of what you're doing, what your bathroom setup is. Oftentimes we ask doctors to prescribe home safety assessments to us so that we can see your home and kind of give you specifically what would work. And then obviously we try to make it, where it's affordable. So the transfer aids that are covered, like I said, the manual lifts covered, and I kind of describe it like you're kind of hanging in a little burrito. In clinic, a lot of times I start talking about a lift. It's called a get you up lift, which puts you in a more natural seated position. And I have on occasion had some providers help with allowing us to provide those, and then you just pay the difference on their cost. So really case by case, I try to make that work. Oftentimes I'll reach out to Melissa with the loan closet, see if they have any of those delivered back. They also are easier to use to help you get from bed into a power wheelchair because you're in a more seated position, like I said. So the other thing that helps with transfers is hospital beds. It allows you obviously to raise up your head and your feet. Like I said before, the manual crank allows you to adjust the overall height of the bed, so that when you're doing a transfer, you can always do it either downhill, or if it's easier, you want to raise the bed up and then go from a higher surface to a lower surface in a transfer. A lot of times we'll ask for a hospital bed to help with even transfers for caregivers. And then the lift chair. So I call these like the lazy boy, the recliners. And when I say that they're sort of covered, is that insurance will cover the motor package, but not the furniture part. So oftentimes I'll just tell folks that if you go to a medical equipment company, oftentimes you're probably looking at a starting figure of like $650. Insurance, I think I looked last time, it was like $175 or something like that on the motor. I just tell folks, just go to Sam's Wholesale or some of the place like Amazon and get a lift chair from there, free delivery, and you're paying less than what you would get reimbursed from Medicare after, because of the motor package. So it's just cheaper. I think the last one I looked at for somebody was like $425. Now you can spend a lot more money if you want, massage and heat and some, cup holders and things like that, or you want a special color to, match your living room set. But I usually tell folks, don't even hassle with insurance on lift chairs. Just get them yourself. Okay, mobility aids. So when someone comes to me and we start talking about equipment, there's an order that insurance wants the physician and a therapist to go through to help make the right recommendation. Insurance likes to see that we're recommending and that they are providing the least costly first. Or if I skip one of these little mobility aids, they want to know why I'm skipping that mobility aid, because that one was cheaper than the one I might be recommending. So in all of our documentation, or my documentation, when I'm doing letters of medical necessity, I'm having to address, have you used and been provided a cane? Can you use a walker? Have you been provided a walker? Lift chair, that's actually the next one in their algorithm of coverage, because it's helping you stand up and walk away with a walker. And then next would be a manual wheelchair or a transport wheelchair. But usually one or the other. And then we move into powered mobility. And then in that category, you've got POVs, which we call them scooters. And then you've got power wheelchairs. So that's the algorithm that I have to address if I'm recommending you a walker or if I'm recommending you a power wheelchair. I have to say why you can't use a cane, why a walker's not working, and why a manual wheelchair of any kind wouldn't work, and then into powered mobility. So one of the big things for insurance rules for us to get equipment is, it doesn't matter what piece of equipment I'm recommending or the physician's recommending or you're needing, in order for insurance to cover it, in our documentation, we have to say you need it for in-home mobility skills. I can't put in there that you need it just to be able to get out into the community to a doctor's appointment, shopping, anything like that. It has to be addressed that it's an in-home need. Equipment provided should last 5 years before replacement. Now, when I say that, I'm saying unless your condition changes. So obviously, if we have a progressive condition, you may first need a cane and then a walker, maybe a manual wheelchair. Oftentimes we kind of skip manual wheelchairs and we go into powered mobility. So this is why, they'll cover a cane, a walker, manual wheelchair before powered mobility. So that 5-year KIOT is most often if you are in a power wheelchair and you need another one, we have to say why it has to be replaced. The equipment that we recommend has to be FDA approved. So in other words, when you come into clinic or we start talking about a power wheelchair and we're making recommendations, it has to be products that are FDA approved. And the reason why I'm putting that in there is there are a lot of really neat power wheelchairs on the market that they are advertising as transportable. And they're great and they work for, smidgets of time, be able to access the community quickly. Caregiver wants something lightweight to throw in the car. Oftentimes those products, not often, most of the time those products are non-covered because they're not FDA approved that you're seeing. There are some on the market that I can show you in clinic. They just aren't the most appropriate for extended periods of time sitting. So oftentimes I'm showing you really the more appropriate power wheelchair for ALS. And then it's also important to note that lighter weight manual wheelchairs, if they're being recommended, and powered mobility devices, all of them require prior authorization. So it does take some time. So some of the things we want folks to think about is when do you start considering the next piece of equipment, or if you need any at all. If you're falling, even if you have a fear of falling and you aren't doing as much activities. Any shortness of breath to complete mobility skills. If you feel like you're less active and participating in activities you used to, you say, hey, why don't you guys go ahead? I'll stay here. That's a sign that maybe you need some equipment, or it just takes you too long to get where you want to go. If you have an inability to use a cane, a walker, or a manual wheelchair safely or independently, or you have a manual wheelchair and you hate that someone has to push you in it, that's a sign that maybe we need to start talking about powered mobility. And then another big thing is you just really have to figure out what's important to you. What's your level of independence? How much do you want? And then, I put in here, not sure what you need and when. It's important to, to talk to your neurologist about mobility issues. Tell your therapist if you have one that you're treating. Call the case manager from the ALS clinic. Call your ALS chapter rep. Maybe reach out to a supplier or anybody that maybe gave you some equipment that you already have and you want to know, hey, listen, this really isn't working for me. The medical equipment companies that provide you the equipment really do know what's next in the process and how to go about it. And then the biggest thing that I always try to tell folks is try to start the process sooner than later. It's not quick. It requires a doctor's visit. They want, a knowledgeable therapist to provide a letter of medical necessity. And there's 2 or 3 other things that the doctors have to sign off afterwards. So it's a paper trail. It takes a while. I'm oftentimes always recommending power maybe before my patient's ready for power because of the process, because of the disease process. It kind of, it might be good on Monday. It might not be good Friday afternoon. So we always try to recommend thinking about power mobility a little bit sooner than most folks are ready. Well, that's what I have there. Do we have any questions? I do have a couple minutes of extra time. So what I would like to do maybe is just talk a little bit about what entails in a wheelchair assessment that I complete. So I'm able to do telemedicine visits. I'm able to do in-home visits if you're kind of in a Jacksonville area. And what we do is we look at, kind of how your home is set up. We show you products that are appropriate for what you need. Insurance wants us to recommend a power wheelchair that can be modified over time without being replaced. So oftentimes the power wheelchairs that we're recommending may to you initially, be a little big and bulky, but they really aren't when you start looking at maybe the width of a walker or a width of a manual wheelchair. Powered mobility is narrower than a lot of the manual wheelchairs that I recommend my folks. They have better turning radius. But insurance wants us to recommend a power wheelchair, like I said, that can be modified without replacement because they're expensive. So a lot of wheelchairs out there that you may see, if I can look at them, I can tell, oh, that one can't be modified. So there's some that can be and there's some that can't. So I can't stress enough how important it is for you all to reach out to your neurologist and make sure that you are sent to a good wheelchair clinic. Obviously, I would love to help you get any equipment that you need, but so that you can really see what's available and participate in that process. Try one before you have them recommend one for you. You also need to make sure that the DME companies that you work with, they have to be knowledgeable. They have to actually have an ATP on staff to provide the kind of equipment that folks that have ALS usually end up getting. So there's a lot that goes into it. We want to make sure that you get the right product at the right time and use your insurance company for what's most expensive so that you don't have any extra out-of-pocket expense or frustration. So I did put my email address here if you have any questions. And then obviously that's my phone number. Like I said, I do wheelchair assessments, telemedicine, and then home safety. So that is it. And thank you for letting me present today.